We have talked a lot about the team in Saskatoon trying to develop a vaccine for COVID-19. It's happening at VIDO-InterVac, a vaccine research center at the University of Saskatchewan. Our Alicia Bridges has been staying in touch with the team and gathering updates on their progress, but she's also finding out what it's like to carry the burden of this work. And Alicia has also been working with the front burner team at CBC Podcasts to share those findings with you. Alicia joins me now. Now, you've been in regular contact with this team of researchers. What have you learned?
I think the biggest thing I've learned is just that making a vaccine is really hard. There are so many regulatory hoops that this team needs to go through, and they're trying to squeeze about 10 years worth of work into a much smaller period of time, about 2 years. So the researchers tell me they're actually really confident that this vaccine will work. They say they're seeing really good results in their testing. It's the timeline that worries them.
So their test results are good. Where are they at in terms of getting the vaccine approved?
Well, they hope to start human clinical trials in November, but their timeline has changed. There are some delays in the process. Instead of March, they now think their vaccine will be ready for manufacturing in June of next year at the earliest. And that, more likely, it will be ready somewhere around the end of next year. There are really a lot of factors at play in that timeline. Some are political, like the Canadian government seems less likely now to fast track that process. And some are logistical. VIDO can't get some of the materials it needs for the last phases of animal testing. And meanwhile, the pandemic continues to affect our daily lives. People are still getting very sick and dying. And the researchers are very aware of that they're among the very few people in the world who have the potential to change it.
And how do they all feel about that?
Yeah, some of them were really humbled by it. Others emphasize that it's really not helpful for them to think about their work like that. Too much pressure could lead them to want to cut corners. And most of them say that they try to take their work sort of day by day and project by project. So the delays are disappointing for them, regardless, though, of any holdups. The local team say that they're still confident that this vaccine will be safe and effective, even if it's not the first to be approved. So they're powering forward with it as fast as they can.
Super interesting update. Thanks so much, Alicia.
You're welcome.
The CBC's Alicia Bridges in Saskatoon. You can listen to her on CBC Front Burners podcast, on the CBC Listen app, or wherever you listen to your podcasts.